Hello, my name is Ryan Giannatasio, and this is my presentation on autobrewery syndrome. Autobrewery syndrome, also known as gut fermentation syndrome, is a very rare syndrome that occurs in men, women, as well as children. When patients present with this condition, they often appear heavily intoxicated, have neurological conditions, as well as a loss of coordination and mood swings. This syndrome occurs in all ages and all people and does not affect a certain demographic more than another. Autobrewery syndrome is caused when bacteria, enzymes, and fungi inside the stomach cause fermentation of carbohydrates producing ethanol, making the patient appear drunk. This condition does not have an effect on cellular respiration, although it is caused by an excess amount of fungi in the intestines. This disease is also not genetic, as it is caused by a complication from other gastrointestinal issues. Many people with pre-existing gastrointestinal issues are at a higher risk to get autobrewery syndrome, although it is still a very rare condition. There are certain treatments to help manage this syndrome and to help patients live with it, although there is not currently a cure. Many people found that helping to cut down on a diet of high carbs and high sugar to a low sugar, low carb, high protein diet found lots of success, as well as limiting the amount of antibiotics they took. Other patients had to also supplement with probiotics as well as antifungal medications to help keep this under control. It is recommended that you work with a nutritionist to help make sure that you are still getting proper nutrition, as well as talking to your doctor about antibiotics that you must take in order to prevent a relapse. There are many issues with living with autobrewery syndrome, such as issues with law and social issues. Many people with autobrewery syndrome have found difficult to keep a job because they often appear drunk, and to the law enforcement, possibly with a drunk driving or a DUI case, because although they were not drinking, body was still producing alcohol, causing them to appear drunk. It is very difficult living with this condition, and there have been many stories and many cases of people explaining the difficulties and challenges that they faced living with these conditions. These are my references, and thank you for listening.